Everybody, I'm going to go ahead and get started. Thank you for joining us today. My name is Brian Dowd. I'm the Deputy Executive Director at the Department of Community Health over policy, compliance, and operations. And I want to thank you for joining us for our May evening town hall associated with EVV. We had quite a robust group of individuals who joined us for the meeting yesterday. I think close to 500 people joined us. So I'm happy that we got another smaller group tonight. We're just going to go over tonight. What we're going to go over is just some updates. I'll go through a list of what we're going to cover in just a second. I do want to encourage you to ask questions at the end of the presentation. They're always helpful for us as far as enhancing the system and making things as easy to use as possible. Well, we start our presentations with the mission of the Georgia Department of Community Health, which is to provide Georgians with access to affordable quality health care through effective planning, purchasing, and oversight. So these are those presentation points I said I was going to go through with you tonight. And it won't be the majority of the presentation. We're just going to do some status updates and timelines. We're going to highlight some training resources for everybody. We're going to talk a little bit about registration, commons, issues, or questions, give you the resources for the EVV Call Center, talk about future town halls, give you a very encouraging third-party EVV vendor update, and then we'll do the question and answer portion. I want to stop before we get started for the status updates and timelines to address a question that I know will come up, and it's come up in every single presentation we've done. And that is this presentation for consumer direction or self-direction? So I want to go ahead and address that off the top. This presentation is for everyone and anyone who wants to use it. So we have made a distinct effort to do a targeted town hall specifically for self-direction and consumer direction. We did that, I believe, 2 town halls ago. We also plan on doing some future outreach specifically and trainings specific to town hall, to consumer direction or participant directed members. But our ultimate goal at the Department of Community Health, and my ultimate goal, and the communications people, I say but it's a group of people who are working on this, is to make sure that all the information that is available to consumer directed and participant directed members as well. You know, I've been doing this quite a long period of time, and I've heard over the years, you need to communicate more. So I'm not putting a stop. I'm not telling people whether or not they need to participate in trainings or don't participate in trainings. I'm not specifically, targeting any or not limiting any information that we pass out or telling folks not to attend presentations. I want you to have the power and the authority to review and understand everything that you want to understand and utilize everything you want to utilize in our PowerPoint presentations, in our town halls, in our communications. We want to make sure that we make everything available to everyone. So where are we with EVV? We began provider training, the intensive provider training, March 16th. We've been doing training for a couple of years now. We did a whole outreach training across Georgia. Lee Clovis and I went to every part of the state. We've been doing these town halls since November, monthly, since November, daytime and evening since November. We have had an open EVV mailbox where I've literally answered, me personally, over 1,000 emails directly associated with EVV in the last 2.5 years. I quit counting when it got over 1,000. I was like, okay, I don't need to know anymore how many emails I've responded to. So that training all has run up and continues ongoing with training resources we'll go through. We did provider registration. The kickoff for that was March 29th. And yes, we did have providers registering March 29th and the 30th and the 1st. And we continue to have providers that register every single day. April 1st, the system was up and ready. You could start entering in your staff. You could start scheduling visits for the members you serve. You could start clocking in and clocking out as of April 1st. We had completed that initial training, and we have been working all through April to do ongoing provider support and troubleshoot any issues. We're into May now, believe it or not. I can't believe how quickly we got to May, but we're in May, and we're really doing a recruitment campaign. So we're reaching out to providers. We have a call campaign. We're going to all the associations. We're working with everybody to make sure that we can get folks on board. We're also using information we're getting from providers to do system refinements. If there are little things that need to be updated or tweaked, we're doing that. And July 1st, 2021, we are looking to target EVV being mandatory for claims processing. Again, I do want to focus a little bit on consumer direction or self-direction here for just a minute to let you know that we are working with fiscal intermediaries. We have bi-weekly conversations with Continuum, Public Consulting Group, and Acumen. So we have bi-weekly meetings, and we'll go over where all the third parties are at this point, which includes the fiscal intermediaries as third parties. So we've got a whole slide that shows you where we are with that, folks, with that work, but we are working to get all those fiscal intermediaries on board here for consumer-directed individuals. So training. I can't encourage you enough to use the multiple avenues for training that we have for the EVV system. One of the most important things you can do to start is the registration training to tell you how to get online. So this link right here in this presentation that we will make available on that same website where we've been making everything available will show you how to get in to do that registration and how-to guide. It gives you descriptions of also on our DCH website, and in this guide, it includes training descriptions, including modules and how long they are. What we feel is most important for you by role, as you see over here in this little slide that we've broken out, is also available in that training guide. So, you know, if you are a provider or an administrator using third party, you really need to focus in on that claims console training. If you're an aide or a caregiver, or you're someone who is hiring your own, you know, aides and caregivers, you're probably going to want to be aware of how your third-party EVV mobile application works. But if your third-party EVV is if your fiscal intermediary is going to be using the TELUS system, then you're going to want to certainly know what that mobile application does. It also gives you step-by-step instructions for registering for training webinars. And that's very important because we have all kinds of ongoing system training, and we have all kinds of existing pre-recorded sessions, which you'll see down here at the bottom. So those pre-recorded sessions, you can just listen to at any time and it'll give you your training. There's a guide on almost every single part of EVV. There's very instructive videos and written guides for every part of EVV. Recommended, this slide, which I probably should have changed, says it's recommended to engage with the solution at 1 month before we go claims live. I'm going to encourage everyone on this call to engage now. The sooner you get registered and get online and start scheduling your visits and start clocking in and clocking out, the better. Middle of this month, we will stand up the claims processing for EVV. That will give you plenty of time to test out claims processing, get those claims moving through the system so that on July 1st, you have no interruptions and no issues with your claims processing. But you can only do that if you get really engaged with the system and start using it. We wanted to spend a little bit of time, we won't spend a lot of time on this, but some of the common mistakes we see from providers that are registering. When you register for Medicaid, you get multiple IDs, and I'm going to go over the next two slides together because it's the only easy way for me to do it. You get an ID, and it may be based on what we call the contract, and that just means what program are you working in? Are you working in the ICWP waiver and providing PSS? Well, then you're going to get that number for that contract, and you're also going to get the number by location. So if you have 5 different offices that are doing ICWP, you're going to get 5 IDs. If you have 5 locations that are working in ICWP and 3 that are working in comp, now you have 8 different IDs because they're done by location, right? And by contract, what programs you're doing. If you're doing ICWP, comp, and GAP, now you're going to have IDs across all those, and it's going to multiply by location. It's really, really important to know that you have to register all of those different IDs because we have to delineate by ID who the staff are and who the members are that are associated there. And each separate Medicaid ID must match the zip code that you use to register that ID. We've had a lot of instances where folks are like, hey, I don't know what all these IDs mean, or they're putting in their payee ID or their central office location zip code, which may be in Gwinnett County for an office that is in Hayhira. And then the system's saying, wait a minute, this doesn't make any sense. That number should have a zip code that's associated with Hayhira, right? So there's a way on MMIS, several of you providers have been kind enough to show me this, where you can print out all your provider IDs and it gives you the information. You can call the MMIS call center if you need help with that. And we'll give you the resources for the EVV call center as well, because they can help you with that too, because they have that information. So this is the same thing. I told you I was going to do 2 slides at once. It's the only easy way for me to do it. So the next question we've gotten a lot is that we need to make sure we clarify with people is, hey, I'm using a third-party EVV vendor. Do I need to register? Yeah, you need to register. Although all your EVV visit information will be passed to us to the telesolution, we still need you to go on, because you'll need to use the claims console for things like training, registering the solution, and it's also some functionality that will need to be used for claims processing. Other common issues or questions. We get, once you register, make sure all of prior authorizations and members are loaded. They should be there. So you'll need to call the call center if you're not, and we'll give you that information again. Users, your employees, will need to be input via either manual entry or import. If you have data that is in collect, again, we'll give you that EVV call center. Another very important thing that we have come across multiple times is the roles in EVV. So there are different roles other than administrator, and data is available based on those roles that you assign. And you should have an administrator for each of your office locations. If you change your administrator, so if I'm the administrator and I change my role to biller, then I'm no longer going to have that full functionality, because administrators kind of like the super user. So you will need to have an administrator that is there for each service location and registration that you have. Another common concern and question we got was related to provider short names. And we made a little bit of error on this one and caused kind of some of the confusion. So my apologies for that. But once you get all those locations, let's assume you have 10 locations, and you got 10 IDs that you're registered for PSS and CLS. You're going to want an easy way to toggle between your offices, right? You can set up a provider short name to be able to toggle between those individual offices. We initially told you that that could only be done at registration, but that was incorrect. You update the provider short name in the administration portal as the administrator after completing registration. So once you have completed the registration, you as the administrator can go in and update all those provider short names to make it easy to toggle between your offices. Make your provider short names, unique, and make them so that you can identify the waivers or the locations, just so it's easy for you to navigate. I don't want to tell you how to run your business, but if I was running a business, I wouldn't want to use EVV location 1, EVV location 2, because now I got to memorize what those locations are, right? I'd want to use something like, hey, Hira source, or something like, Cairo comp, so that I know, okay, this is for the comp program and it's in my Cairo office. This is the information for the EVV call center. You might hear us talk about, well, they're going to open a ticket. What that means is if you call this call center and they cannot immediately answer your issue, then they often open a ticket to figure out what the issue is. Maybe they have to go back to MMIS and see what's in that system. Maybe they have to come to the state and ask for clarification. But they will open a ticket and then they'll get back to you with what that issue is. But if you are having that missing data issue that we discussed, if you're really struggling with getting those IDs registered, call the call center. Use that 833 number, 701-0012, and they will walk you through the process. We also provide an email option and a website for chat. If you go on the DCH website, there is a cheat sheet on the DCH website that will give you all this information and who to contact and what's the best way to contact. You can continue to write the EVV mailbox that I'm in, and I'll go over that address in just a second. But I'm going to be honest with you, all I do now is forward those issues to the EVV support email and ask them to follow up with you and you will call back. I do monitor the call center. I do monitor all of the tickets and the stuff that has been sent over. Me and the team of folks, we constantly monitor that information. But the quickest route is to go directly to the call center. So I want to take a bit of just a quick second to remind you that all of the town halls are available on our website under both the provider and the member pages. And this does include the town hall information with self-direction. So all that information is available. Not only the slide decks are available, but also we record every single town hall and post that information. So if you want to go back and listen to yesterday's presentation and the questions that came out of yesterday's presentation, you can do that. If you know people who need to get caught up, lately I've had several people who have written me, well, about 8 or 9, that have written me in the last couple of weeks that say, oh, I really need to get caught up with this. What's your advice? And I'm like, first thing I would advise you to do is go to our website and look at the town hall material, because we've been very methodical to step through the process in the town hall presentations. So upcoming town halls, we will be doing 3 more town hall meetings. We may do other ad hoc trainings or meetings on top of that. Again, we will do some more consumer direction and participant direction, reach out and training, but we have 3 more scheduled upcoming town halls. They will all have an open Q&A, and we're going to target the topics based on the feedback we receive from you guys. Make sure you're going to the DCH schedule of events to look for those registration links. This is the exciting slide that got updated from yesterday. This is all of the third-party vendors, right? So everybody who has an EVV system that is private out there, we have been keeping track of who they are, if we know about them, and we've been keeping what status they're in. So just to give you what the status is, if you see the folks in black, those folks we've had contact with, but we haven't gotten an agreement with them yet. So we definitely have contact with them, but as of right now, we don't even have an agreement, a contract with them to use the EVV system. The folks that are in blue are contracted. So they've signed an agreement with us and let us know, hey, we're going to be moving forward to integrate our EVV system with your EVV system. The folks that are in green are actively in the testing process right now. So not only do we have a contract, but we've been passing information and data back and forth to make sure our two systems can talk to each other. The really exciting thing that got updated from yesterday is the folks that are in red. Usually red means stop or bad, but in this case, it means they're production ready. They're ready to go. So we went from having, everybody initially was pretty much just in black and they were not, in any other color. We've gone to the point where we now have 1, 2, 3, 4, 5, 6, 7, 8, 9, 10 folks that are already production ready. So they're ready to go. And we've got another one that's in purple that's in pilot. And now we do have two providers that have declined integration. They said they are not going to be using their EVV system to integrate to our EVV system. So I would advise you, if you are a provider that is using one of the agencies for third party in orange, to get in contact with them. If it's PSS or CLS and you're using their system, if you're using their system for something else, that's not really relevant. If you're using it for adult day health or community access group, that's not relevant. But if you're using it for personal support services or community living support, and you have one of these two agencies in orange, you need to get in contact with them and ask what the plan is for 7-1, because claims won't process 7-1 without them being connected to us. How to find all the information I've talked about. Just go to our webpage. If you don't have it already, just Google DCH EVV and then click on the one that ends in georgia.gov and all the information will come up. You'll see the member tab, you'll see the provider tab. You can click through frequently asked questions. You can listen to all the presentations. You can get all the information. We make absolutely everything available on the website. If you need to ask an individual question following this meeting, maybe it's personal, maybe you want some one-on-one time where you explain or need somebody to talk to you, we can schedule that as well. You just need to utilize this EVV mailbox to ask those questions. All right, we are at a stopping point. I'm going to leave up the EVV mailbox information just so you have it. I'm going to pull down this screen and hope that it doesn't cover too much up. And I'm going to ask for Lee Clois to help me with the questions.
Yeah. All right, Brian. First question. Will an Acumen rep be available on the next self-direction webinar?
So we have engaged Acumen and we are having them every 2 weeks with us. We can certainly ask that they be available. They have their own communication streams as well. So I can't tell you that they will be when I haven't really had that discussion with them, but I'll certainly have that conversation. And we'll try and get them on our next webinar. Lee Clois, I figured out a way to look through the questions myself, so I got it.
Okay, sounds good.
Thank you, though. So the next question is, when appropriate, can you address the following requirements for EVV? In third-party attestation, the following is stated. Can you explain this in greater detail? Canceled eccentric status, transmit changes in visit within 60 minutes of change, 24/7. So Kathy, you're welcome to send me that question to the EVV mailbox. We have kind of a different standard transmission status based on who the provider is. So that was something that was kind of talked about and agreed upon between our MMIS vendor and TELUS. If you have concerns or specific questions that are related to that, you can certainly send it to me. We have providers that do a lot quicker transmission, like many of you may know Alliant, which is our external review organization. They transmit data to us about every 6 minutes. So if there's concerns or questions with that, if you could give me a little bit more information specifically to the EVV mailbox for third-party attestation, I would really appreciate it.
Hey, Brian,
For self-directed,
you want me to add anything? I can add a little bit more on this one. So there is a requirement on the attestation for the third parties that they send us an update in status every hour. And so what does that mean? Well, that a visit goes through multiple different statuses. Most systems, the visit is scheduled, then it is started, then it is ended, then it is completed, and then it is ready for billing. And so what we ask is that the vendors send us updates to all visits every hour. That way our system can remain current, because if we just waited until the visit was ready for billing, if a provider bills every 2 weeks or longer, then our system will not be current and it will always be behind. And so this way we can remain current on the status of every visit that's going on out there for reporting purposes.
Thank you, Joe. And feel free to contact me if you have questions or concerns specifically related to that. Next question is for self-directed families. What trainings do we need to do? I know we can do them all, but what will we be using? So let me address that question yourself. It depends on who your fiscal intermediary is. So your fiscal intermediaries have different ways that they're going to be processing through this. So you really need to be having an open dialogue with the FIs. That the FIs will be putting out information as we move forward and doing their own specific training. So, you know, our ultimate goal, if at all possible, is to not have folks disrupted. So we want you to use the existing systems that are out there. Now, I say that, and I'll be honest with you, like I always am, I was shocked to hear how many people out there in the self-directed world were still doing most everything on paper. So we're going to have to move from a paper world to an EVV world because it is a federal mandate, right? So we will need to make that transition to using an automated system. So your account will go through who your fiscal intermediary is, and we'll be providing you, again, more training and update on that. As far as what you can do, what you should be looking at now, you need to be going back and looking and making sure you attended the town halls that were specific to consumer direction. And then I would go through the Q&As and look through the Q&As. But you need to self-direct and go through those things and see what's best for you. We'll also, again, be working with your fiscal intermediaries to get you more information as we move forward. The next question says we're our agency and waiver provider numbers, but still all of our members are not showing. You need to address that to the call center. If you have addressed it to the call center and it's been a significant period of time, you can write me specifically. We have staff members that are, myself and others, that are going through to look at those. I have gotten some of those, and I'm going to be honest with you, as providers, a lot of times the issue isn't the interface that we're seeing right now. It's members that are not active and don't have a PA in your system. But if you know these are your members and they're out there on MMIS as your members, then please do let us know about that. Follow the procedures and go through the call center first. But if you're not getting the proper response from the call center, then I want you to go ahead and contact the EVV mailbox and we'll look into that. Next question is about confusion about being self-direction and saying it's a little confusing because we're talking about providers. And that is true, but you're a provider, right? So that's kind of why it's a little confusing. When you're in the self-direction world, you're a little bit of both, right? You're often the authorized representative for members, but you're also acting as the employer. So it is a little bit confusing because you're going to do both. So again, we're asking that you keep yourself aware of as much of information as possible. I am not going to limit the information to folks. That's not something I'm going to do. We have done targeted town halls. We did one specific targeted town halls, and we will have additional town halls and trainings that are associated to participant direction. I answered the next one. So the next question is, what about historical punches, which is a different way of saying clock in and clock out? So we will have the ability, if there are changes or retroactive PAs that happen now, to have that information be loaded. Joe does a really good job of talking about if you have a member in the system, but you don't have a PA, that you can go ahead and schedule that PA and do the clock in and clock out, and it will just hold in a pending status. It won't release through to claims, because in order to release through to claims, you will have to get that information updated to have the current PA information, because it's checking it. But we'll have the ability to do retroactive. Next question is, what should we do if we have public partnership as our fiscal agent for the participant direction program? We have heard nothing from them. Well, good news is we have biweekly meetings, as I've stated, with all of the fiscal intermediaries. So in our next fiscal intermediary, we'll have that discussion with them and make sure that they and us have a communication plan for folks that are with public partnership. So I believe that meeting is either later this week or early next week. So we'll try and get that out as quickly as possible. When an individual gets their new budget for the year, there is usually a gap in time between the old budget expires and the new one shows up with the fiscal agent. How will providers be putting in their hours? Well, I think I talked about this before. There is a way that you can go ahead and schedule and put in the time. It just won't be able to be released for claims until that PA is updated. So I hear you that you did call the call center for the individual who said that they were having trouble having people show up. I totally hear that you did call the call center and you have not gotten a response. My email is this email down here at the bottom that you need to write. I monitor that email box. So please send in your concerns to that email box, evv.medicaid@dch.ga.gov. I'd be happy to give you my personal email too, but this is the email you need to send it to track. When you guys send me emails directly to me, they just go to the EVV mailbox. So all you're doing is giving me an extra step and delaying the time that we can address it, because we need everything tracked to the EVV mailbox. So go ahead and write evv.medicaid@dch.ga.gov, and we will put it in the queue to get it addressed. Great. I'm glad you're emailing me now. That is a great thing to hear. Okay, so that's the end of our questions. I want to thank everyone for joining us today. I do want to encourage you to use the call center and this EVV mailbox if you have additional questions, comments, or concerns. If you do need specific time where you need to speak to me individually, I have said this since November. I am more than happy to set up time to discuss issues with you individually. Again, I know it's 6 o'clock on a Wednesday. I know I've been working since 7 this morning, so it's 6:34 now. So I imagine a lot of us are very tired. So I do want to thank you for your time and your participation today, and I hope you have a lovely evening. Thank you.